Welcome to the Holistic Wealth and Health Podcast. Your co-hosts, Jason Smith and Brian Bibbo, will inspire and teach you how to prosper in your mind, body, and spirit, not just your financial life. Joining forces with field experts, Jason and Brian are here to help you focus on what matters most in your life, living well.
Hello and welcome to the Holistic Wealth and Health Podcast. I'm your host, Jason Smith, and we have Dr. Mona Shah joining us today. And she had a long-standing relationship with Jeanette Bajalia, lead advisor for us down in our Jacksonville office. Welcome.
Thank you. Thanks for having me on.
Yeah, and you said you've known Jeanette for quite some time.
Yeah, almost 10 years, I want to say.
Oh, that's awesome. Yeah, I appreciate you coming on here. This is definitely a topic that I've talked about with some other physicians on the podcast in the past.
Sure.
Just because I had open heart surgery, Dr. Shah. I'm not even sure if you knew that.
No.
But, yeah, May 31st of this year. So I had a heart valve, aortic valve replaced and some other fun stuff. But I'm good to go. Yeah, it was a gift my grandma gave me. I had it my whole life.
God, you look like you're doing pretty good.
So I'll give a quick bio on you.
Yeah.
Board certified in cardiology, holistic medicine, and cardiac CT, and is Northeast Florida's only triple board certified holistic cardiologist. She runs One Heart Cardiology, a concierge practice dedicated to personalized preventive cardiology with a holistic approach. Very cool. And check this out. This is interesting. So after I had my surgery, my primary care physician, which is the head of functional medicine at Cleveland Clinic, and he referred me to someone who's got almost sounds like very similar at Cleveland. He's the only one at Cleveland Clinic.
Okay.
And so he is a holistic medicine cardiologist.
That's awesome.
So it is so cool. And then I was excited to get on the call with you today. He's not necessarily a podcast kind of guy, and you're absolutely a podcast kind of girl, I think.
Because I love to talk, so I don't know. I love to educate.
Yeah, I gathered that. Yeah. So I'm super excited to have you on. So thank you so much.
Yeah, you're welcome.
Yeah. Yeah. Share with our audience today a little bit about yourself, other than the nuts and bolts of what I gave. What inspired you to start One Heart Cardiology?
So I've been practicing cardiology for almost close to 20 years, and majority of that has actually been in the hospital-based traditional system where you're seeing 25 patients a day, you grow your panel, all the traditional hospital-based, that's how they work. But I've really probably in the past 10 years and even more so in the past 5 years, just felt the pressure of that, especially once I got board certified in holistic medicine. The reason I got board certified in holistic medicine is once I started practicing cardiology after I graduated fellowship many years ago, I realized that it was very dissatisfactory to have a patient come in, see me for chest pain, fluttering, whatever it may be. I run the typical tests. And if I don't find anything, I'm left with, and the patient's left with, I don't know, maybe go back to your primary care doctor. They should maybe do some other tests, but really don't have any solution for them from the heart standpoint. And so I started finding that a lot of patients, besides just their physical symptoms of chest pain or breathing issues or fluttering, have a lot more going on, right? Whether it's diet related or stress related or not exercising, vitamin deficiencies. And I started learning more and more about this through patients and really understanding that there's a lot more we're not taught any of this in medical school, right? I'm sure you've heard that maybe before, where maybe have a day of nutrition, definitely no stress management, definitely nothing really about vitamins or supplements, right? And so as a doctor graduating from medical school, you're left with, okay, here's the meds, here's the testing, and that's it. As I started exploring this other field of more than just that, looking at the whole person with a W, I decided I don't want to just dabble in this. I really want to do this the right way, hence the board certification in it. Long story short, while I started doing holistic and cardiology, it's extremely difficult to manage and talk to patients about their diet, their lifestyle, their stress, vitamins, and then, oh yeah, we got to talk about your heart too in 15 minutes. It's very difficult. And then also the more patients you get, if I see you and hey, let's run these labs, then I want to see you back. Oh, wait, you're booked out 6 months. So that whole scheme for me just was not working anymore. And I decided to let me leave that type of practice and open up One Heart Cardiology, which we're actually just open about a week and a half now. And it's
No
been,
kidding.
yeah, it's brand
Congrats.
new because I left the hospital system right at the end of the year and started this end of January because I already had patients. When are you opening? I got to see you. When are you opening? I'm like, I
Yeah.
just left. Let me take a breath and open up a new business, which starting your own business, that's a whole thing. But anyways, long story short, I've already seen several patients and it's been amazing just being able to spend 60 to up to 90 minutes with them, really going every aspect of their health, going over that. And then if they do send me a message or have a question, it's me that answers it, not some other staff and all that, which are great. They're there. Staff and nurses are there. They have to be there. But I want to have more of a hands-on approach with my patients. And this allows me to do that and order more advanced testing and practice preventative cardiology the way I want to.
Yeah. And so this is like concierge medicine specializing in the heart with the holistic medicine methodology applied. That's really cool.
Yeah.
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 How about let's talk about kind of men and women, right? And what the difference that you see. I'm curious about this. And when it comes to heart issues, are there more that you're seeing with men versus women? And then what are the approaches that suggest typically to address some of those things?
Sure. So in general, as we know, as we learning more about, is that men and women, the number one cause of death is heart disease. And so I think we've made great strides educating the general population that is the leading cause of death. I think for men, that was pretty well established, but for a long time, women and a lot of people thought that they're going to die of breast cancer, right? Where we know 1 in 30 will die of breast cancer, and it's 1 in 4 to 5 for heart disease for women, right? And the other thing we also know is that women under the age of 50, if they have a heart attack, are twice as likely to die of that heart attack compared to a man the same age.
Wow. Why is that?
So I think we're getting better. Again, I keep saying that because I feel like we are getting better than where we were 20 years ago. So
Yeah.
a woman and a man like a woman, if she comes to the ER with chest pain, let's say, right?
Yeah.
Sometimes they're not as quick to get the EKG, to get the labs, to get them taken care of as fast as a man. Again, I think educating the ER, educating hospitalists and all that, we're making great strides. We're
Okay.
still behind. The other thing is a lot of studies on heart disease for medications and et cetera are on men, right? We know that women have sometimes a completely different we have smaller arteries, right? So we might not have a 70% blockage or an 80% blockage causing that pain. It might just be 50, 60%, but that 50, 60% is acting like a 70, 80% and causing the chest pains. I think that's a big piece of it is just one is how fast are they getting treated? And men as well, but women a little bit more have more of the atypical symptoms. You know, when you think of having a heart attack, you think of, okay, elephant sitting on your chest. If it's not that, then it can't be a heart attack, right? But women more can have pain behind their shoulder blades, abdominal pain, more fatigue. How many people are tired? A lot of people, right? And so those kind of symptoms can be brushed off as well. This is distress, or I'm getting older, or I ate something bad, and then not get addressed as quickly. Again, same kind of thing.
So is it like if I'm a woman that's listening to this and some of the things you said is like easily to be dismissed as it's
Right.
just this or that or the other, at what point or what's like a key indicator that you would want to be like, you really need to take action and get this into
Yeah,
place?
that's a great question. And that's what I tell my patients all the time is, listen, I'm seeing you once in whatever it is, 3 months, 6 months, maybe even a whole year. Your body for however many years yourself. If someone comes to me and says, I've been fatigued for 10 years, I'm not going to maybe jump up and down as much. I'm going to maybe do some testing and try to see if I can figure out maybe even more from the holistic standpoint. But if someone says, hey, 6 months ago, I was able to walk 3-4 miles, and now I'm getting a little bit more tired, or I'm having this pain in the back, or I'm more winded. It's that change. Something that's not right for you is what I try to tell people is pay attention to your body signs. I'd rather someone be overly concerned about what's going on than blow it off and say, I'm just going to go to bed. It's probably just a long day or something like that. If there's a change in what's normal for you, and sometimes it can be gradual, right? It might not be a week. It might be like a 6-month slow kind of, I've just been getting more and more tired, winded, not feeling right. So it's that change is when I say, come in, let me at least get some basics testing on you and talk to you.
So you shared some of the sneaky ways that it can show up for women and they don't realize it. Is there any for men that aren't the common that you've seen?
Yeah, so men can have the same exact symptoms that I just mentioned. They can have abdominal pain, they can have back pain. They more traditionally will have chest pain. Now, that being said, or being more short of breath, right? So my 2 red flags for me is, hey, I'm more short of breath or winded, or obviously having heaviness, especially on exertion. If they're sitting there watching TV and they have random little 1-second pains, but then they're running 5 miles, okay, maybe we'll get you checked out, but I'm not as having red flags go off. But all that being said, if you're a diabetic man or a woman, all bets are off about what your symptoms are going to be, because diabetics traditionally, they can still have these typical symptoms, but diabetics, my red flags are going to go up even sooner because they're at such high risk for heart disease. And some patients have silent heart attacks, and those most commonly are diabetics. They don't even know that they've had an event, which is when I tell them, I'm like, oh yeah, when did you have your heart attack? And they're looking at me like, what are you talking about?
Why is it that diabetics can't,
Because I think it's more because of the nerves. We know that diabetics have less of the nervous system, the nerves and the sensations, the pain is definitely diminished. And so we think that's what's going on as far as the nerves and the heart, and the discomfort that you feel is not as evident in some diabetics.
Okay. All right. Learned something. What are some preventative measures that we can take to keep our heart healthy?
Yeah. So, 80% of heart disease is preventable. People's jaw drops usually when I tell them that, but it is true. And when you say preventable, we have 2 categories of risk factors. One is things that we can't do anything about, right? Our age, some genetics, and for the most part, our sex that we're born with, right? We really can't change those. Right. And the things that we can change or work on or modify are high blood pressure, cholesterol, being diabetic, obviously smoking, stress management. And then genetics are in both playing fields, because you can inherit a gene, but if you don't do exactly maybe what your predecessors did to turn it on, even though you have the gene, you might not necessarily turn it on, if that makes sense. Okay. So genetics are very important. I tell patients, like, listen, just because you have the gene, if you're trying to do something different in your lifestyle, it might not be a factor for you.
Yep. Which, like in my case, was born with the valve. There's nothing preventative. I don't believe I could ever.
No, I don't know. Not for that kind of stuff. Unfortunately, there's no prevention.
Yeah, exactly. So let's talk about the lifestyle factors, right? Yeah. These are old but true, and everybody probably has heard of most of these things, but let's talk about what you feel is most important.
When going back to your earlier question and tying it into this question as well, I mentioned high blood pressure and diabetes and cholesterol. And a lot of what I'm trying to say on those aspects is know your numbers, meaning know what your blood pressure is on the average, right? I'm not saying check your blood pressure every day, but high blood pressure is silent. Sometimes people go years with having high elevated blood pressure and have no idea that it's affecting them until things have already were on this side of it, right? I tell every single one of my patients, I want you to get a blood pressure machine. They're like $40 on Amazon, throw it around your arm, check it every couple of weeks, right? Like just know. So that way, when you do go in to see the doctor, you can say, hey, I do check it at home and these are my numbers. Because often, right, people come into the doctor and they have a white coat. So they're nervous, and especially seeing a cardiologist, that's no fun. And so I always tell my patients, listen, your number here in my office is a little bit elevated, but that could just be because you're here, you have to see a doctor and all the stuff. So just please make sure you get a blood pressure cuff at home and check it once in a while and write it down. And let's make sure, is it really white coat or do you actually have high blood pressure? Same thing for diabetes. It's not like you can check your sugars. You can actually check your sugars at home, but if you're not known to be a diabetic, you wouldn't naturally just be randomly checking your sugars. But when you go in for your annual physical, have your primary care check a hemoglobin A1C, right? See, are you pre-diabetic? Because pre-diabetes, if you don't make the changes, guess what's coming? You're going to be full on diabetic, right? I go another level. Part of the holistic advanced lipid testing is I get an insulin resistance score on patients because that kind of shows me even pre-diabetic. Let's catch this way ahead and start trying to make lifestyle changes. Cholesterol, know where you're sitting at. What is your LDL? What is your HDL? What are your triglycerides? What are your numbers for that? Do you have anything genetic that could have been passed down? I often get more than just a regular lipid panel. I'll get an advanced lipid panel because to me, an LDL is just a number. I could have two people with the same exact cholesterol LDL, but they're eating completely different and their arteries look completely different. So I always want to do a little bit more than scratching the surface. I want to know, is your cholesterol, is it sticky? Is it inflamed? Is it big? Is it small? Do you have genetic factors? It's just a lab test anyways. So that's so as far as preventative, as far as knowing things, just be aware. Don't bury your head in the sand until things happen and then you're trying to figure all this out.
Real quick, how often do you suggest the blood panels be done? Or how do your patients, is it quarterly, semi-annually? What do you suggest?
Great question. Again, every patient's different because I always like to look at everyone on a different standpoint. But if someone's just walking into my office, let's take somebody, and this is often what I get. Hey, I'm 50 years old and my friend who was healthy just had a massive heart attack. I don't want that to be me. So that's what I get a lot. And so my standard is obviously getting this advanced lipid panel. And depending on what that shows, we have to decide, how are we going to handle this? Are we going to just go straight to meds, which most people don't want to do? Are we going to do some supplements? Diet's always going to be, no, I don't care what you're taking or doing. I'm always going to talk about, what are you eating? I want to hear it. I want to hear breakfast, lunch, and dinner. I want the details of what you're doing. Let me help you figure out, let me give you some good suggestions. But then if we make changes, then I'm going to want to see if those changes are effective in 3-4 months, right? I'm not going to go a whole year and say, okay, see you in a year. Hopefully, good luck. But if someone's stable, if they're doing pretty good, I've been seeing them for years, we're steady, we've done all the things, then I'll probably be okay with the once a year panel. Okay. But at least once a year, if you're not on any treatment or you just want preventative, definitely at least the minimum should be once a year where you're getting your diabetes, pre-diabetes checked, your cholesterol levels checked. Hopefully you're checking your blood pressure, like we just mentioned, a little bit more than the once a year annual check. And I also do on the preventative side is I'll order often calcium scores. I don't know if anyone's talked about that before or if you know what that is. And we can talk about that. I know that's not what part of this question was, but for preventative, for lifestyle, it's exercising. And exercise, what does that mean? So there's so many different caveats with exercise. I at least say, hey, if you can even walk for me for 30 minutes a day, I'll take it. Because there's been enough studies that show that 30 minutes of walking a day will decrease your heart disease risk by 10 to 20%. Some medications don't even get to that point, right? And walking is free. It does take some time, but it's not only good for the physical body, but it's also good for the mental health, right? We've heard of the runner's high. You don't have to be running to get that natural high. You can walk. I tell people, do whatever you like to do. I'm not going to say, oh, you got to do this cardio and this weight lifting. a resistance, once we're at the next level, then I'm going to try to incorporate resistance training in that as well as the cardio. And then if I can throw in some yoga too, I'll throw in that as well for just some of the stress management part of it.
So I didn't hear you say pickleball. Pickleball counts.
Oh yeah, that's to me cardio, right? So when people, I'm always saying, especially here's women and men, but especially women, once we hit that perimenopause state of 40, 45 and up, it's extremely, our muscle mass, men too, but women even more drastically, our muscle mass goes in the pits. And so the sooner we can start some sort of resistance training, whether it's weight training, actual weight training, or bands or whatever, it's so important for men and women to have some sort of muscle mass on them. So cardio, to me, I tell people, do whatever you want. Honestly, I'm not going to be picky about your cardio. Do whatever you want. I'm going to be picky about your weight training and your resistance training.
You've just tuned in to part 1 of our conversation. To be updated on the latest Holistic Wealth and Health podcast episodes, subscribe to your favorite podcasting platforms or find us on YouTube on the J.L. Smith Holistic Wealth Management channel. Thank you for listening to the Holistic Wealth and Health podcast. We hope we inspired you to make changes so you can live your best life. If you want to find out more about what we do, or if you want to have a holistic wealth and health financial plan, please call 456-833-7000. Please subscribe to the podcast and share it widely with your friends and family. Financial planning and advisory services are offered through Prosperity Capital Advisors, PCA, an SEC-registered investment advisor with its principal place of business in the state of Ohio. J.L. Smith Holistic Wealth Management and PCA are separate, non-affiliated entities. PCA does not provide tax or legal advice. Insurance and tax services offered through J.L. Smith Holistic Wealth Management are not affiliated with PCA. Information received from this podcast should not be viewed as individual investment advice. Product discussions and illustrations are hypothetical in nature and will vary based on many factors, including, but not limited to, age, health, product, insurance carrier, and product design. You should consult the insurance carrier website and policy for detailed information. For information pertaining to the registration status of PCA, please contact the firm or refer to the investment advisor public disclosure website, www.advisorinfo.sec.gov. For additional information about PCA, including fees and services, send for our disclosure statement as set forth on Form ADV from PCA using the contact information herein. Please read the disclosure statement carefully before you invest or send money.